So in this mailbox, we've got syringes, naloxone kits, and sterile water. And these are some of the safe use supplies that SWAP distributes throughout the province. This year in particular, their services have increased. They've distributed way more than usual. So we're here with them today to find out why and to see how they do it.
We have two types of needles. We typically refer to
in these boxes, clean needles, glass pipes, and filters. SWAP sees drug use as a common reality. Their goal is to make it safer, to avoid infection and overdose, to save a life. Demand is higher than ever.
We know that a large portion comes from just people not knowing about us and just accessing us for the first time. They were already using drugs, just, not with our supplies.
This is what the public usually sees when it comes to drugs. A police news conference, stacks of drugs, and a warning.
It's scary. The problem is there's no safe dose.
The drugs are here, people are using, a fact of life for SWAP. They are the province's sole provider of life-saving medical supplies for drug use. All that responsibility is on the shoulders of just 3 people.
It's a lot, we wish we had more of a capacity, for sure, but we're doing what we can, of course, to serve the whole province.
SWAP drops off to personal mailboxes, pharmacies, and community groups for free. But material for isolated places relies on Canada Post. Mailing safe use supplies eats up almost half their operating costs.
It's not like all of our towns even have cell service. And if we weren't able to mail things out there to get to at least some of the people there, where else, what else would they have? Nothing, right? We are so often the only program that people are even able to connect to just based on where they live.
SWAP is the province's direct supplier of naloxone kits. It's the drug that can save someone from an overdose. Last year, they distributed more than 5,000 kits. That's an 140% increase.
But in all honesty, there's still a lot of stigma, so much stigma, even just about, carrying naloxone. We get a lot of oh, I don't know anyone who uses drugs, or that's not for me, I won't need that. But ultimately, just like a first aid kit, we recommend having it because why not, right?
Demand for naloxone started to spike in July 2023 with reports of overdose deaths. That's when the public warning started.
It's going to continue to get worse. We're going to continue to see more deaths until there is an alternative to, the unregulated supply. You also never have to question if your alcohol is different than what the label says, right? That's kind of the difference there.
Drug use is a reality, so are the risks. The tiny SWAP crew is working to reduce those risks and keep people alive. Julia Israel, CBC News, St. John's.